Did you ever wonder how obesity impacts health and what might be an effective treatment? Obesity is a global health crisis with severe consequences on our overall well-being. It's not just about the extra pounds, but the myriad health issues they bring along, from cardiovascular disease to diabetes. In our ongoing quest to combat obesity, one solution has stood out: bariatric surgery. This medical intervention is gaining attention and popularity. So, let's dive into a recent medical article that sheds light on this. This medical article takes a hard look at the effects of bariatric surgery versus non-surgical treatments for obesity. It's a systematic review and meta-analysis based on a random effects model, which essentially means it's a statistical approach to combine results from multiple studies. The article draws from an extensive range of data sources, including Medline, EMBAS, and the Cochrane Library. These databases were searched from their inception to December 2012, with no language or publication status restrictions. That's a lot of information to sift through. Eligibility criteria for the studies included in this review were stringent. They had to be randomized controlled trials with at least 6 months of follow-up. The participants had to be individuals with a body mass index of 30 or more. The studies compared current bariatric surgery techniques with non-surgical treatment and reported on body weight, cardiovascular risk factors, quality of life, or adverse events. So what did these studies find? The results of this analysis are quite revealing. In this systematic review and meta-analysis, it was found that bariatric surgery leads to significant weight loss, on average 26 kilograms more than non-surgical treatments. This is a substantial difference that can greatly impact the health and well-being of individuals struggling with obesity. Moreover, the study showed an increased remission rate of type 2 diabetes and metabolic syndrome in those who underwent the surgery. Imagine not just losing weight, but also breaking free from the chains of these chronic illnesses. The benefits didn't stop there. The individuals who had bariatric surgery also experienced significant improvements in their quality of life. They found themselves less dependent on medication, an important factor that often goes unconsidered. In terms of other health markers, plasma triglyceride concentrations decreased more, and high-density lipoprotein cholesterol concentrations increased more among the surgery group. However, like any treatment, bariatric surgery is not without its drawbacks. While the benefits are clear, we must also consider the potential adverse effects. Among the drawbacks of bariatric surgery, iron deficiency, anemia, and reoperation stand out as the most common. About 1 in 7 individuals who undergo malabsorptive bariatric surgery encounter iron deficiency anemia. Moreover, roughly 8% of individuals require reoperations. In conclusion, bariatric surgery appears to offer significant benefits in the treatment of obesity. Compared with non-surgical treatment of obesity, bariatric surgery leads to greater body weight loss and higher remission rates of type 2 diabetes and metabolic syndrome. However, results are limited to 2 years of follow-up and based on a small number of studies in individuals. Therefore, more long-term studies are needed to fully understand its impact.